Last week, I told you why your gums bleed in perimenopause. Today, I'm going to give you 4 things that actually help with bleeding gums. And one of them has been sitting in our deen for over 1400 years. So if you have been swishing mouthwash and hoping for the best, stay with me. Because this week, we are combining mainstream medicine, holistic care, and our Sunnah, the way I always do, into 4 simple practices you can start doing today. Watch this video to find out exactly what they are, what evidence actually says, and how to fit these practices into your everyday life. Assalamu alaikum and welcome to my channel. If you are new here, my name is Dr. Nikita Islam. I'm a gynecologist turned perimenopause health coach. I'm also a revered Muslimah and a mother to 3 wonderful children, alhamdulillah. I help Muslim women navigate through perimenopause and menopause with more energy, focus, and confidence by following holistic wellness practices that are safe and effective, easy to follow, and aligned to our deen. Remember Sarah? Last week I told you about Sister Sarah, who was convinced she had been neglecting her own teeth and oral health, when really it was just her hormones all along. Watch this video here to learn about Sarah's story. Well, Sarah asked me the obvious next question. Okay, all that makes sense, Dr. Nikita, but what do I actually do beyond the basics you've already given me? So this week is for Sarah, and it is for you too. 4 practices, each one doing a slightly different job. Each one backed by something real, not just a trend that you've seen on a reel. 4 different practices. Remember the builder estrogen, who used to quietly maintain your gums, the collagen, your saliva. And when she comes and goes in perimenopause, plaque builds up faster in your mouth than your mouth can clear it on its own. So the goal of everything I'm about to share today is simple. Reduce the bacteria sitting on your teeth, your tongue, and in that plaque before it has the chance to irritate your gums and make them bleed. And your gums are already more sensitive than they used to be. So the first practice, oil pulling with coconut oil. So take 1 tablespoon of extra virgin organic coconut oil first thing in the morning before you eat or drink anything. Swish it around gently in your mouth, getting into all the cracks and crevices for 10 to 15 minutes. Yes, 10 to 15 minutes. Then spit it into the bin, never the sink, because it can actually block your pipes. If it's too difficult, start with 5 minutes and then build up. A systematic review on the evidence. It has been found that oil pulling can reduce the bacteria and plaque sitting in your mouth, but the studies are small. So dental associations do not recommend oil pulling as a replacement for anything. So oil pulling is a lovely add-on, not a substitute for your normal brushing and your flossing. And remember always, natural does not equal to safe, and natural also does not mean instead of. So layer it on top of what you already do. Second practice is tongue scraping. Here is one most of us skip completely. Most of the bacteria causing bad breath and feeding the plaque are not on your teeth at all. They're actually sitting right at the back of your tongue. So get yourself a simple copper or stainless steel scraper, and each morning gently pull it from the back of your tongue to the front 4 or 5 times, and then rinse in between. A study on tongue scraping found that doing this twice a day for just 1 week measurably reduced the bacteria living in the mouth. 30 seconds That's all it takes. One little tip, you don't need to wait for the tongue scraper to arrive if you've ordered it online. You can use any metal spoon for the same purpose. Just keep a dedicated one in the bathroom along with your toothbrush and use it. Mind you, your family will raise eyebrows. What's that spoon doing there? And that's your opportunity to educate them so that they can start to follow the simple yet highly effective practice as well. Tongue scraping is something that our parents and grandparents did without thinking. Now, I remember as a child, each one of us would carry our own toothbrush and tongue scraper whenever we traveled. It was quite normal to do so. It's only when we got older and we changed our ways and started getting embarrassed using a tongue scraper, that's when we sort of abandoned it. At least I did. And I abandoned it for a good many years, and I've only revived this practice 3 years back, and I've seen some really noticeable difference. The third practice is the Miswak. This is the one that I love the most because this is from our deen. The World Health Organization officially endorsed the Miswak back in 1987 as a genuine alternative to a toothbrush. And a review of the evidence found that it reduces plaque and gum inflammation, which is a cause of the gum bleed, to a level very close to brushing alone. And when you use a Miswak along with your toothbrush, the results are even better. Now, our beloved Prophet ﷺ, he said that were it not for the fear of overburdening his followers, he would have actually ordered all of us to use Miswak before every single prayer. Subhanallah, he knew all these centuries back what science is just catching up with now. So keep one by the sink, use it before wudu, and let cleaning your mouth before you stand in salah become a small, quiet act of worship, not simply just a hygiene habit. The fourth practice, Xylitol. This one is for the moments you cannot brush. So maybe after lunch at work, after the children's snacks, maybe in the car. Xylitol is a natural sugar substitute, and a study found that chewing xylitol gum reduced plaque by more than 20% and measurably lowered the very bacteria linked to gum disease. So what it does is xylitol starves the bacteria that feed on ordinary sugar. So they simply cannot multiply the way that they normally do. So reach for a xylitol gum or a mint instead of a sugary one. And that way you can keep these bacteria in check. Make sure that the label for the gum has xylitol very near the top of the ingredients. And now you've turned an ordinary habit into one that is actually working for your gums. To recap, oil pulling with 1 tablespoon of extra virgin organic coconut oil, 10 to 15 minutes if you can, on an empty stomach. Tongue scraping every morning, back to front, 4 to 5 strokes. Evening if you can as well. The Miswak, used alongside your toothbrush, ideally tied to wudu and your salah. Xylitol gum, or mints instead of sugary ones whenever you cannot brush. Now this video is for education only. It is not meant to self-diagnose, and none of this replaces your dental or medical care. So please do not self-diagnose, and do keep seeing your dentist about any bleeding that does not settle. Now, if your gums have been trying to get your attention, and that's why probably you're watching this, it is very likely your body is sending you other quiet signals too. If that is so, I have something for you. A free 14-day midlife reset. One small 5-minute practice a day, doctor designed, faith aligned, no diets, and no overwhelm. But before that, share your thoughts in the comments, and don't forget to like, share, and subscribe for more discussions on women's health during perimenopause and menopause from a mainstream medicine, holistic and Islamic perspective. To get the free reset, click the link in the first comment. Jazakumullah khairan for watching, and inshallah I will see you in the next video. And remember, your best is yet to come.